Hello, my name is Thomas Crisas. I'm a physical therapist. So I want to tell you a little bit about the field of physical therapy. I currently have my doctorate in physical therapy from Shenandoah University, and I got my master's at George Washington University and undergrad at the University of Maryland in College Park, Maryland. So I wanted to touch base and discuss a little bit about some information on the educational process. So if you want to go into physical therapy, you have two different options. One, you can become a physical therapy assistant, which is 2 years of an associate's degree after high school. So you go to high school, then you do 2 years in the classroom and clinical work, and then afterwards you can become a physical therapy assistant. Or you can choose to become a physical therapist, and what that is, it is 4 years of undergrad and then 3 years of graduate school. An entry level is now a doctorate in physical therapy. So you would do a little bit of a mix between coursework in the classroom and then clinical work where you're actually out and doing like clinical rotations. It's a phenomenal career where you can kind of help people ranging from traumatic brain injury to spinal cord injury to orthopedic injuries, rehabilitating for people that just have pain, chronic pain. You can work with pediatrics, you can work with people with heart conditions. I'm doing like cardio rehab. Basically, people that want to get their life better, that need to be rehabilitated and guided through that process, you can help with that process. My personal specialty is orthopedics, so I work with patients that after surgery or that are having back pain, neck pain, shoulder pain, that they're not really sure what's going on with it. So it's a very good profession that if you like to work with people and do hands-on work, you like the medical side of things as well, you like the sciences, anatomy, physiology, the way things work, like with physics and biomechanics, different things like that. It's a great career. The long-term projection for the career is very good because as the baby boomers get older, that population is going to need physical therapy. So it is a pretty strong position for physical therapists to have, as well as the physical therapy assistant. The difference between physical therapist and physical therapy assistant is that physical therapists can do evaluations and reevaluations and assessments for discharge, things like that. The physical therapist assistant is helpful to kind of work together with the physical therapist to deliver the plan of care as set up by the physical therapist. Salaries, they range, of course, but on average, the physical therapist makes around that $73,000 to $74,000 range per year, but that can range. Again, that's the average, so that can range sometimes up into like the $100,000 range if you're well experienced or you're managing clinics, and then starting salaries around that like $65,000 level. Also for a physical therapy assistant, their starting range is typically around maybe around that $18, $19 an hour frame, and then also it can go up to, depending on where you're working, depending if it's orthopedics or if it's working in a hospital system or a nursing home, you can make upwards of 25, sometimes even like that $30 an hour range, depending on that. They're both great professions within the physical therapy world. You're always helping out and making a difference in people's lives, and there's no greater joy where at the end of the day you can look at yourself and say, you know what, I really made an impact on somebody's life. So thank you.